Hello and welcome to Agent Navigator's presentation of Medicare Supplements 101. We'll be going through the very basics of Medicare Supplements. My name is Mike Catorna with Agent Navigator. Go ahead and start looking at these. A Medicare Supplement, sometimes called a Medigap, is an insurance policy that's a secondary payer for Medicare beneficiaries. Now, these plans are written by private insurance carriers and offered to Medicare beneficiaries, and they could be above age 65 or below as well, getting Medicare through disability. And they'll help cover the coinsurance and deductibles that Medicare does not pay. Now, it's important to note that these are only medical policies and they do not cover prescription drugs. If a beneficiary wants drug coverage, they will need to purchase a separate Part D program. Now, these plans are designated by letters, such as Plan A, Plan B, etc. And all carriers follow the same coverage standards. These plans are standardized. Example, Plan C through ABC carrier is the same coverage through XYZ carrier. So Plan C is Plan C is Plan C. It will always be the same benefits. Now, the plans will vary in premium, and that will depend on a combination of level of coverage, age, location, smoker, non-smoker, carrier, so on and so forth. Now, plans are funded through premiums paid by the insured, unlike Medicare Advantage plans, which are paid by Medicare directly. So the only money that Medicare supplement carriers are getting are actually through premiums paid. Now, as mentioned, these plans are secondary to Medicare. So once a claim is submitted to Medicare, the supplement is the secondary payer source. Now, the client normally has no paperwork to do. Most providers are very accustomed to working with supplement companies where they will send the first bill to Medicare and second bill to the supplement company. And since Medicare is primary, as long as the provider accepts Medicare, the client can use them. So there's no limited network. As long as they accept Medicare, the client can use them. And that is nationwide. Now, if the supplement does not cover the service provided, obviously the client is responsible for the claim. So looking at levels of coverage, now here's a basic Medigap plan chart for after June 1st, 2010. Prior to June 1st, 2010, there were some different plans available. However, these are the new plans that we have. As you can see, if there is a check mark, the Medigap covers 100% of the described benefit, unless there is a percentage. Now, it's important to note that the Medigap policy only covers current insurance after you pay the deductible. Part A and Part B of Medicare have deductibles, so it may or may not cover. So here you have the benefit, and here you have the different plans in their structure. Now, it's important to note that every Medicare supplement company has to at least offer Plan A in a certain area. Just because all these plans are available, Medicare supplement providers do not have to offer all the plans. They could only offer A, C, and G if they wanted, or A, C, and M. It's up to them. Now, as you can see, Part A coinsurance hospitalization up to 365 days. So they all cover that. Now, they all cover the Part A hospice. They don't all cover your skilled nursing. A and B do not. And so on and so forth. Your Part A deductible, your Part B deductible. Really, the most common plans you probably see in the marketplace will be C, D, F, G, and N. M and N are newer plans. N is kind of a hybrid plan that compete against the Medicare Advantage market. Now, C and F are essentially the same plans. As you can see, C has almost all check marks except Part B excess coverage, where F has all the check marks. Now, Part B excess means that if a provider is not happy with the set amount that Medicare is allowed to bill, they could charge 15% above the amount. So if a procedure costs $100, the doctor could bill up to $115. Plan F will cover that. Plan C will not. Most doctors don't take advantage of this, so C is a very common plan. Now, D and G are almost similar. As you can see, D does not cover the Part B excess, where Plan G does. However, neither of those cover the Part B deductible, the yearly deductible of $162. So those four plans are the most common plans you'll see out there. Now, Plan N is a little different because Part B coinsurance, which is your 20% after deductible. Plan N has copays, $20 copay for office visits and $50 for emergency room visits. And it also does not cover the Part B deductible as well. So obviously the more check marks, the more expensive the premium because it's covering more things. So all your Medigap enrollment kits will have some sort of chart like this in there, and typically the carrier will highlight what plans are available. So they will have a full explanation of each kit you have. Now, as I said, there were missing plans. As of June 1st, 2010, plans E, H, I, and J are no longer being offered. Now, beneficiaries who have those plans can keep them in place. And as mentioned, they all have to offer Plan A, but they can choose to offer other plans above and beyond that. Now, the reason E, H, I, and J were eliminated is that Medicare decided to expand their coverage and cover things that they didn't in the past. And because it did that, these plans replicated other plans, such as J had some drug coverage, which was no longer relevant with the creation of Part D. So the plan was eliminated. Now, enrollment can be done anytime during the year with these programs. Now, these plans are underwritten, and clients must have both A and B of Medicare. However, there are guaranteed issued at certain times throughout a person's life, such as when they first get Medicare Part B, they have 6 months to enroll into any plan. Now, if they did purchase an MA plan when they first age into Medicare, or they decide to try an MA plan later after their initial enrollment, they have basically a year from the time they first try an MA plan to go back to a supplement. So they have a 12-month test drive the first time they pick a Medicare Advantage program. And then they could go back into any plan. Now, if they're coming off group or COBRA coverage, or if their Medicare Advantage plan leaves the service area, they have limited guaranteed issue to A, B, C, F, K, or L plans. Now, suitability for these plans, some pros and cons. One of the pros we talked about, there's no network to follow other than Medicare, so as long as the provider accepts Medicare, they can use them. Depending on the level of coverage, such as Plan F, one premium may have basically 100% coverage. They're portable, goes wherever Medicare goes, with some overseas coverage. And there's no MIPA rules for marketing. MIPA is rules set forth for Part C, Medicare Advantage, and Part D, prescription drug marketing, where you cannot cold call, cannot go door to door, you cannot make outbound calls to prospective clients, where Medicare Supplements do not follow those regulations. Now, some downsides of Medicare Supplements is that the premiums may be unaffordable, especially as people age. They tend to see their premiums rise. They may not pass underwriting. They may be sick and may not be able to get a Medicare Supplement, and they also need a separate drug plan, so they will have to have a couple policies in force, where some Medicare Advantage programs offer all-in-one packages. Now, a good guide to have and to look through is a Medigap. Choosing a Medigap policy. These are typically included in most Medigap enrollment kits, or you can download this guide at Medicare.gov. Good little piece to have to flip through, maybe dog ear some pages that are important to show your clients. Well, that is the very basics of Medicare Supplement plans. As you contract through these programs, you'll get training materials, but this does give you a basic overline of Medicare Supplements. But for more information about supplements and other senior market products, please see agentnavigator.com. We thank you very much and have a great day.